Thank you, Chairman, Dr. Tanaka. My name is Yoichi Hiasa from Ehime University. So my title is Risk of Hepatocellular Carcinoma after the SVR in Hepatitis C virus infection. Next slide. Okay. Oh, sorry. This is my disclosure. And I'm from Ehime Prefecture, so Ehime means a lovely princess. So it means very delicious food and very nice view and warm climate. So, but now it is afraid to come to because COVID-19. But if after the COVID-19 elimination will come to Ehime. So this is the number of the candidate. Excuse me. So according to cancer type, so liver cancer is the 5th rank. It is the number of the deaths is higher compared to the number of patients. It means the liver cancer has a poor prognosis. So persistence of the, as you know, the chronic disease risk of the liver cancer increased. So step up and liver cirrhosis will come to the most of the among the around the 8.0% evoke the liver cancer. This is a change in etiologies in Japan. So cirrhosis among the cirrhosis, HCV is 48.2%. That is the highest, and this is the recent data in 2018 that was analyzed in the 54th Japanese liver meeting. So present is the chairman Nishiguchi. And hepatitis C is now the most most common cause of liver cirrhosis in Japan. Ehime Prefecture has the highest liver cancer mortality rate actually. So we need to announce the patient to treat and care and to follow up. So we announced the Ehime Prefecture populations people. Please take the examination, blood test examination to check the hepatitis viruses. As you know, now the DAA treatment is common, and especially the grecaprevir and pibrentasvir or rezavasvir or plus sofosbuvir or velpatasvir or sofosbuvir is very common. And so combination of two drugs is effective for elimination. So we analyzed the data in the Ehime Prefecture. So we named that the ECAN study group. As you know, that result is very good. So in the cirrhosis patient, 96.3% is effective, and also for the patient with decompensated cirrhosis. Our result indicated that the 100% of the SVR. So risk of HCC after interferon and DA treatment. So we can see the systematic review. So in this report, there is no difference between the interferon and the DAA treatment. Also for the occurrence of HCC, and so also, but for the recurrence of HCC. So this is a table indicate that risk factors for hepatic carcinogenesis in patients after interferon treatment. So we have a consensus that age and sex and liver fibrosis and high level of AFP would be risk factors for evoking the HCC. But what is the risk factor of HCC in ADA treatment? HCC occurrence after DA treatment in hepatitis C, we analyzed the data and shown here cumulative incidence of HCC was 2.9% of the patients, and HCC incidence case is 35 from the 1,212 cases. So we analyze the data, and univariate analysis indicates those input those values, and we input those variables, and finally multivariate analysis indicates that sex and albumin, low level of albumin and high score of the FIFO index is a risk factor. So this is analyzed data from the pre-treatment data of DA treatment. So FIFO index, as you know, that it is a very nice predictive non-invasive test for liver cirrhosis. And it includes that the age and the AST-ALT ratio and the platelet count. So we number the scores for the sex and level of the albumin and the FIFO index after the analyzed data threshold from the AUC analysis. And finally, we can identify the three groups, so high score and intermediate group and low score. And so a male and a low level of the albumin less than 3.8 gram per DL, and the FIFO index more than 4.0. Those are risk factors of occurrence of HCC. So we analyzed again, including at the end of DA treatment for HCC occurrence after DA treatment. So after the univariate analysis, those factors are extracted, and then do the multivariate analysis. Finally, we can identify that high level of the FIFO index and high level of the post-treatment AFP, mean the AFP levels at the end of the treatment. So we number the scores, those factors, and finally we can identify the three groups. A high score group is a very high risk of the HCC occurrence, and the risk factors indicate that the AFP more than 6.0 at the EOT, and FIFO index more than 4.0 is eradicated. So we have one question. Are late factors after the DA treatment more useful to estimate the HCC occurrence? So we analyze the risk factors, including the data at the time of 12 weeks. So this is a background of the patients, and so 1,741 patients are enrolled. So the data of the cumulative incidence of HCC is shown here, and HCC incidence is 94 patients from the 1,741 cases, so that is 5.4%. And in 5 years, so 9.8%. So univariate analysis indicate those values, and put into the multivariate analysis, we can identify that the sex and AFP level and FIFO index and albumin level at the time of SVR12 is risk factors for occurrence of the HCC. So factors at SVR12 evaluation, we think that are more useful predictive factors for HCC. So male has a higher risk rather than a female. And AFP levels at the time of SVR12 more than 4.0 is a high risk. And FIFO index at SVR12 more than 2.95 is a very high risk. And also the level of the albumin at the time of SVR, so less than 4.1 is high risk. So we score the number in those factors, and make the graphs like that. So a very high risk group has 13.7% and of the HCC occurrence. And instead, a very low risk group, 0 or 1 point is no cases of HCC. So this is summarize statement. So HCC occurred in 94 of the 1,741 patients for 5.4% during 3 to 4 years after the DA treatment, and male and high AFP at the time of SVR and FIFO and albumin at the time of SVR. Those are the risk factors of HCC. So the group of patients fulfilling all above 4 high-risk factors had 13.7% of patients with HCC, whereas the group of patients without these 4 risks have no cases of HCC. So how about the risk factors for HCC recurrence? So risk factors of HCC recurrence after DA treatment in patients with HCC we analyzed. This is the background of the patients, and number of the patients is 199. So median observation period is 659 days, and 97 from the 199 patients. So it means the HCC recurrence ratio is very high, 48.7%. So in 3 years is most half of them are recurrence. So factors associated with recurrence of HCC after DA treatment, we can identify by the univariate analysis, sex, so male, and SVR, no SVR, or the number of curative treatments for HCC. Those factors also identify that from the multivariate analysis. And a graph is like that. So a male and no SVR and more than one treatment is high risk. So we scored the points. So a high score group, so all of them has that is in 2 years, 55.8% patients has recurrence to HCC. Instead, there is no risk of them. 22.54% of the patient has recurrence to HCC. So risk factors of HCC recurrence after DA treatment in patients, male, no SVR achievement, and number of curative treatments for HCC was the independent risk factors for the recurrence of HCC after DA treatment. So we noticed that the change of the graph like that. So within the 1 year and after the 1 year, so there is a difference in the recurrence rate within 1 year and after the 1 year. So we separate so early recurrence and late recurrence, and both each phase for each phase. So we analyzed. So are the risk factors between early phase and late phase different for the recurrence of HCC? So what is the predictive risk factors at early phase? So within 1 year, we identify the post-treatment AFP and SVR or no SVR, or number of days from HCC treatment to DA therapy initiation, and number of curative treatments for HCC. Those are identified from the univariate analysis. And after the multivariate analysis, only the post-treatment AFP level was identified. So AFP more than 6.0 has a higher risk of the HCC recurrence in early phase. So what is the predictive risk factor at late phase? So sex and the EGFR and the post-treatment EGFR, those are identified from the univariate analysis. And after the multivariate analysis, only the post-treatment EGFR were identified. So the cumulative incidence of HCC is like that. So so less than 70, so EGFR indicates a higher risk of the HCC recurrence in the late phase. So factors associated with less than 70 EGFR at the end of the treatment we analyzed. So then we identified the age and the number of curative HCC treatment were identified. And more than 70 EGFR, so a good function of the renal function. So in those patients, so diabetes mellitus was identified as a risk factor. So a patient who has a DM and without DM, so they are different in such kind of, you can see the graph. So the difference was occurred. So are the risk factors between early phase and late phase different for the recurrence of HCC? So post-treatment alpha AFP as an independent risk factor that contributes to HCC recurrence in the early phase. Instead, the post-treatment EGFR was identified as a risk factor in the late phase. So low post-treatment EGFR was associated with the frequency of HCC treatments, and the complication of DM could be a risk in good EGF patients. So this is summary. So SVR rate of HCV for both compensated and decompensated cirrhosis is over 90%. So SVR with DA treatment reduces the risk of HCC, and the risk of HCC is reduced after SVR but remains. So need to understand the risk factors of HCC for each patient and need to follow up. So the recurrence rate of HCC after DA treatment is extremely high. We need to be especially careful for the patients who had treatment HCC before DA. Thank you for your attention.